Italy was the first country in Europe to suffer a major COVID-19 outbreak. It was also the first nation in the world to impose a travel ban on China. But a new study suggests the earliest coronavirus strains circulating in Italy might not have come directly from China, where initial cases were first identified in the central city of Wuhan in late 2019. Researchers in the Italian city of Milan collected over 300 blood samples from COVID-19 patients in the Lombardy region, where Italy's first outbreak occurred in February. The samples were randomly chosen from people admitted to hospitals with mild, moderate, or severe symptoms. In their study, which has not yet been peer-reviewed, the researchers found the samples did not contain the genome sequencing of viral strains in the first months of the outbreak in China. The study also shows that there could have been multiple introductions of the virus to Lombardy. One possible source was Central Europe, where virus strains with similar genetic mutations to the Italian samples have been detected. The Italian study is one of several around the world to claim that they have found strains that cannot be traced back to China. In New York, most coronavirus strains circulating in March did not come directly from China, according to joint research by the US Centers for Disease Control and Prevention and the New York City Department of Health. Instead, the researchers say the virus was probably introduced from Europe or other places in the US. A French study released in May found that the COVID-19 outbreak in that country also had no direct link to China. And another study by Russian government scientists found that out of 67 introductions of COVID-19 into their country, only one was related to a Chinese source. Beijing officials have also pushed back against evidence that points to the city of Wuhan being the origin of the coronavirus. A research team led by Spain's top biologists identified the virus in a wastewater sample in Barcelona that dated back to March 2019, and drainage samples collected last November from a Brazilian beach town and stored in a government research center later tested positive for the coronavirus. But infectious disease experts say that while such findings have the potential of becoming major stories, the research requires more scrutiny. At least 10 countries and regions have successfully identified their patient zeros, or first cases found within their borders, but scientists have yet to identify a global patient zero, the first person in the world to become infected.